The topic is mineral deficiency. So, why are minerals important? Because it is essential for enzyme function, energy production, and immunity, also vital for bone health, nerve function, and fluid balance. Basic examples for common minerals include calcium, iron, magnesium, zinc, etc. And the types, there are mainly two types of minerals, macro and micro. Macro minerals are major minerals which requires more than 100 milligram per day, for example calcium. Micro are trace minerals, need lesser than 100 milligram per day, for example iodine. Some other examples for macro and micro minerals include calcium, magnesium, potassium, phosphorus, sodium chlorides are macro minerals, whereas iron, zinc, copper, iodine, manganese, chromium includes under micro minerals. First, we'll see calcium deficiency and its treatment. Normal value is 8.5 to 10.5 milligram per deciliter. The disorders includes rickets, osteoporosis, and hypocalcemia. And the treatment. Diet is first and foremost. If it is not sufficient, then go for supplements, vitamin D supplementation, regular sun exposure, medication like calcium infusion or parathyroid therapy. Dietary sources are dairy products, green leafy vegetables, fortified orange juice, seafood like sardines and salmons with bones, shrimp, nuts, and seeds. Next comes phosphorus deficiency and its management. This is the normal value. Deficiencies are rickets in growing children, bone pain, muscular weakness. Treatments, dietary adjustments, supplements like phosphate salts, address underlying conditions like diabetes, kidney issues, avoid excess calcium supplements. Dietary sources include dairy products, fish and seafood, meat and poultry, beans and lentils, soy products, almonds, sunflower seeds, and pumpkin seeds. Next comes sodium deficiency and its management. The normal range of sodium is 135 to 145 milliequivalent per liter. Functions are maintenance of fluid balance, transmission of nerve impulse. Deficiency results in hyponatremia, muscle cramps, fatigue, and disorientation. Treatments include increase sodium intake by diet, adjust fluid intake, then intravenous sodium, usually 3% saline is given, or diuretics, and last treat the underlying conditions. Next comes the dietary source of sodium, which are table salt, cheese, soy sauce, and teriyaki sauce, pickled olives and vegetables, bread rolls, bagels, and baking soda, baking powder. Next mineral is magnesium. This is the normal value. It is a mineral which helps in transmission and muscle function. Deficiencies include malabsorption syndrome, persistent vomiting, chronic renal failure, abnormal heart rhythms like arrhythmias. Treatment increase dietary magnesium, supplements like magnesium citrate, chloride, oxide, or sulfate, and treat the underlying condition. Dietary sources are spinach, pumpkin and sunflower seeds, almonds, whole grains, black bean, lentils, chickpeas, kidney beans, and these are the excellent plant-based magnesium sources. Iodine deficiency and management, normal value. Then iodine, the basic source of iodine is seafood, iodinized salt, and egg yolk. It functions as synthesis of thyroid hormone, so the deficiency will result in goiter and hypothyroidism. Treatments, supplements as potassium iodine or iodine tablet as such, or thyroid hormonal therapy and prenatal supplements during pregnancy. Then comes zinc deficiency and its management. Functions are immune response, wound healing, cell growth, and DNA synthesis. This is the normal value. Deficiency result in delayed wound healing, growth failure, hypogonadism, underdeveloped sex organs, more seen in case of males, and infertility. Treatment, oral zinc supplements, zinc fortification, that means food fortification programs add zinc to the common staples like flour or cereals to combat widespread deficiency and address the underlying conditions. Dietary sources, the richest source of zinc is oyster, then red meats, legumes, and whole grains. Iron deficiency and its management. Normal hemoglobin levels, And now comes deficiency. Iron deficiency anemia is a common one. Cognitive impairment, restless leg syndrome, and developmental delays in children. Treatment: oral iron supplements like ferrous sulfate, vitamin C supplements or food like citrus fruits, intravenous iron treating underlying causes, and finally blood transfusion in severe cases. Dietary sources include organ meats like liver, kidney, legumes, lentils, chickpeas, and beans, green leafy vegetables, then vitamin C rich food like citrus fruits. So, thank you.